Welcome back to Champion News Talk Radio, brought to you by championnews.net. This is Carol Parisi. Our founder, Jack Roser, and myself have our great guest with us, Mr. C. Stephen Tucker, the expert on health care. And Steve, during the break, you said something about millions of people losing their health care. That can't be true. This is supposed to put millions of people on health care.
Yes. Well, if you blindly believe President Obama, who said if you like your plan, you can keep your plan, and no one will take it away from you, period.
Who called him a liar? Or not true?
Well,
was it Joe?
Joe Wilson was the first, and then our own Joe Walsh was the second, right from his office in D.C. But both men were true. Both men were speaking the truth. Barack Obama has lied on this issue and many more issues, but specifically this one. And we know this now.
Did you say that the President of the United States lied?
Yes. Yes, he is, in my opinion, a pathological liar.
Steve, you mean our listeners could potentially
Steve, you're
lose
a man
their health care?
of a temperate attitude, and I ask you that because I think your opinion is worthwhile. You're an expert in this field. You make your living out of it, have for a considerable time. You're successful at it. And but in the times we've talked to you on this program and otherwise, you've been, well, more of a statesman than our president, for sure.
Most people are.
This is, think how vital all of this is, in the sense that the single-payer systems don't work out for us consumers, do they?
No.
It hasn't worked out with education. Tell us a little bit about how the system works presently and how it's really going to change under Obamacare.
So here's what's coming. What's not being reported in the media and hasn't been reported is that thus far, we have had 13 health insurance companies that have exited the individual and family health insurance market.
13 companies.
13 companies. One of them right here in Illinois, Guaranteed Trust Life, they're up in Glenview. They were one of the first ones to exit the individual market. Now, when an insurance company goes out of business or exits the individual health insurance market, what happens to their policyholders? They lose their plans, right? So back in 2010, when they began the medical loss ratios, Barack Obama still today is saying medical loss ratios are great. You get a check back from the insurance company.
What are medical loss ratios?
The medical loss ratios were a part of the law that said if you're a health insurance company and you underwrite more than 50 people, you must, by January 1st of 2011, lower your entire operating margin, not your profit margin, your entire operating margin down to 15% or less. Okay? If you underwrite less than 50 people, you have to go down to 20%. So most of the smaller carriers operated on razor-thin margins. Okay? They were at 25, 30, 35%, some carriers. All of a sudden, they had to cut down to 20 or 15. They realized they could not do that in the short amount of time allotted to become compliant by January 1st of 2011. So they simply exited the individual market.
Now, what is the difference with the individual market versus a group plan market? They're still in a group plan market, but individual people cannot buy insurance through these carriers any longer.
That's correct.
Okay.
And they lost their health insurance plans. Okay. This is a letter from Guaranteed Trust Life that my clients got all over the country. And the letter states that they will be losing their health insurance plans. And it says, will I be offered a replacement plan? Yes, we're required by the law in terms of your policy to offer you replacement coverage. I'm reading from the letter. The replacement will be a high deductible major medical plan. This type of plan doesn't begin to pay for covered charges until such charges exceed your new deductible of $25,000 per person. Now, the person who got this letter lived in Naperville, who was a client of mine, who bought a policy from me more than 10 years ago that had a $5,000 deductible for the entire family.
$25,000 per person.
She lost her plan, right, in the middle of breast cancer treatment. And she had put money aside in what's called a health savings account for many, many years, right? She was healthy all those years. She loses her plan on May 1st of 2010 in the middle of treatment for infiltrating ductal carcinoma, could not afford a $25,000 deductible for family. So I had to move her from her plan that she lost onto our state high-risk health insurance pool. Now, this is the damage that's been done since 2010. So starting in a week from today, on October 1st, millions of Americans around the country will start receiving letters from their insurance companies. Now, the letters are going to come from 3 carriers in the state of Illinois: Blue Cross Blue Shield of Illinois, Aetna, and Humana. And these letters, and I have them up at truthaboutobamacare.com so you can see advanced copies of them, are making these Humana, Aetna and Blue Cross clients aware, these are individual family policyholders, not small businesses, individual family policyholders.
Not big businesses.
Not big business, individuals. They have two options. They can either keep their existing plan, right, until December 31st of 2013. At that time, they will have to have their policy fundamentally transformed, which means it must include all new 10 essential health benefits that are coming under Obamacare that business plans already have. In these 10 essential benefits are things like drug rehab coverage, are things like maternity coverage with no waiting period, even if you're 9 months pregnant. Whenever the government piles on mandates onto health insurers, it drives premiums up. So all these people are going to lose their existing plans. They're going to have to get an Obamacare approved plan by December 31st and pay the rate increase that's coming, and it will be substantial.
Percentage-wise, what type of substance?
We don't know yet. We're waiting for the fourth quarter premiums to be released to the Department of Insurance so we can say, here's how much it is. But I can guarantee you this, it won't be less, because you can't put 10 new mandates on policy.
You know what? I
and
don't
rates go down.
understand why a 70-year-old couple would need maternity coverage.
They don't.
Or drug rehab coverage.
They don't.
What is this that you have to have all of this buffet of stuff that you're never going to use? That's a waste.
These are government, state, and federal agencies that put mandates on health insurers, and they force them to cover things that are not medically necessary. So let's go back to 1979. In 79, there were a total of 252 mandates placed on all health insurance companies in all 50 states, or 57 if you're Barack Obama. Now, fast forward to the year 2009. There were a total of 1,900 health insurance mandates placed on every carrier. Fast forward post-Obamacare, today, there are over 2,262 mandates on health insurance policies, and you can see them all at truthaboutobamacare.com. You'll notice as you're scrolling through the list that things like hair plugs are mandated to be covered.
Joe Biden put that one in for himself.
Health club memberships, right? Massage therapy, right? Infertility. And now we have maternity on every policy, no waiting period for no extra charge. Well, these things are not free, okay? We've already added 65 preventative care tests, things like a colonoscopy that Barack Obama sells as being free. It's not free. Somebody has to pay for it. That's a $3,000 test minus facility charges. So what happens? The carriers just raise the rates. Okay? But here's how Barack Obama is going to hide all those costs. All right? As of 10/1, when you go into the health insurance exchange, if you make less than $46,000 a year of modified adjusted gross income, which is after taxes, after retirement contributions, you're going to go in the exchange. Let's say you're a family of four. The average income for a family of four in 2012, according to the U.S. Census, was $51,089. Okay? So you go in the exchange, and what you'll see initially is the real cost of Obamacare qualified health plans, gold, silver, bronze, and platinum plans. The bronze plan, the cheapest plan for a family of four, depending on where you live, will cost between $16,000 and $18,000 a year. Okay, very expensive.
Well, that's what Jack is paying
That's
for
what
his
Jack's paying now,
employees right now.
Okay, now you're going to put your income level in at $51,000, your number of members in your family, and hit enter. And what will happen is the taxpayer will be providing what's called an advance premium tax credit. It's money right away to lower that premium artificially. So they're actually going to pay about $3,000 a year, even though the cost is $16,000 a year, because the proud, the 51% of us who pay income taxes in this country will be subsidizing it. And it doesn't go to them, it goes to the insurance company. Now extrapolate that over hundreds of millions of Americans who will get these advanced premium tax credits.
There's something I was a little puzzled about, and I want you to straighten out. You've shown me right here how there's going to be a deficit in the medical care that's going to older people. And that deficit they had planned in the taxpayers would have to pay more were to be the young people.
That's right.
And they were going to have to take out policies, otherwise pay a penalty.
Yes.
I understand, and I'm not like you. You're a professional, but I understood that the young people are just going to, since they're well and they can enter this thing anytime they want anyway.
Right.
They can wait before they pay for insurance care. They can wait and just pay the penalty.
Right.
So they're going to pay the penalty instead of the cost of their thing.
That's right.
So that money from these always well young people that's supposed to balance the books for the elderly.
Not going to happen.
Not going to happen, is it?
Not going to happen. What you're referring to is community rating.
Community.
Is what?
Community rating. Okay, this is a liberal piece of legislation. It has been implemented in 8 states already. In every one of those 8 states, like New York, it has failed miserably. What it does is liberal legislators walk into a state and they say, we have people over here in the state that are paying more for health insurance than people over here, right? So we want to make it all equal. Everyone should pay the same premium.